Here's a question. In the course of working on the book, did you find yourself thinking differently about the body and the place of the body in treatment? It's partly a rhetorical question because presumably by the end of the book you would have, but yeah, do you find that your thinking of the role of the body in treatment has changed since the book or during the book?
I mean, it's pretty radically changed, actually. I mean, lately, and this is, really in the aftermath of the book, not just COVID, but I've also been working on chronic illness. And I have a group of analysts who are working with like 50 or so chronically ill patients. And so then like every week we have case presentations, and I've been listening to these analysts work. There's the old Susan Sontag line that illness is not a metaphor. And I really take that seriously. I mean, I took it seriously when I started writing the book, but I actually feel like I take it more seriously now. And that what we're talking about, or at least or what I'm talking about when we talk about conversion disorder, when we talk about even psychosomatic symptoms, is that it's real. And that we cannot leave that behind, that it is real. And this is also what I love about psychoanalysis, is that we're not just talking about psychology. We're not just talking about ideation. We're talking about something real. And I know that real is a trope within Lacanianism, but to really see that real on the level of the body is important to me. And not just in terms of jouissance or enjoyment, but something real that can happen biologically. And I've started to go back to forensic. And I've started to go back to Freud's phylogenetic fantasies of, the kind of fantasies of Lamarckian evolution and what takes place in our bodies and the traces of that linger there and that are present in the diseases that we're susceptible to, the problems with sexuality as on a cellular level. And I find this enormously helpful. I mean, especially in the excess of discourse that we swim in our virtual lives, to go back to this way of thinking about the body and the origins of psychoanalysis in that kind of psychiatry, a rare kind of psychiatry, I think, that wants to think about whatever, the immune system in relationship to glia cells in the brain, to cut out the kind of psychopathology version of psychiatry and to think on, Freud cutting up eels. So it really did change me in that way.
I love this quote from early on in the book. You say, in the experience of tracing one's drive, the body emerges as the ground zero of analytic work and the analytic cure. So that was supposed to just reiterating some of what you said, but maybe placing a little bit more of an emphasis on the dimension of drive as well. And I suppose that prompts me to ask, how does one do that? I'm sorry to ask these kind of impossible questions, but in this tracing one's drive, how does one do that? How does one trace one's drive, and how does one facilitate that kind of work within a treatment?
It's funny because I have this split training. I mean, I have the Lacanian trainings that I've done, and then I have this very classical Freudian drive theorist. I tried to pick the drive theory people over the ego psychologists. They can sometimes be the same person, but there are these sort of hardcore Freudians left around. And that was always their emphasis. I mean, even like a very kind of classical idea of a psychoanalytic history of a patient. I mean, you ask about the toilet training, you ask about the breastfeeding, you ask about the illnesses that you had as a child and when they took place and what was happening when they took place. That you think on this level, you're listening to the patterning of the drive. You're listening to the drive over the course of someone's life. You're listening to the solutions that they had. You're listening to the fixations, to use a very classical phrase. There's that. And I find this enormously orienting. Then there's listening to it in the here and now, work with the patient. There's listening to it in terms of the fact that the minute the analysis has started, you're on some kind of trajectory. So it's a very old idea, but the session is responding to the session before. And that week was responding to the week before. And some interpretation was made and you're listening to the aftermath of it. And this is to listen very carefully for this orientation of the drive. Not to know where it's going, not to necessarily know what it's doing, but to keep following it.